COVID travel, crew well-being during COVID-19. Pandemics can be stressful. Coping with stress in healthy ways will make you, the people you care about, and your fellow crew members stronger. You may have experienced or might experience increased stress during this pandemic. Fear and anxiety about this disease can overwhelm your coping skills. As a ship crew member, you are at increased risk for exposure to COVID-19. Like many other viruses, the virus that causes COVID-19 appears to spread easily between people in close quarters aboard ships and boats. You can take steps to protect yourself and others from COVID-19. Learn more about healthy ways to cope with stress and staying connected during COVID-19. As a cruise ship member, how can I protect myself and others? Commercial shipping, including cruise ships and other passenger vessels, involves the movement of large numbers of people in closed and semi-closed settings. Like other close contact environments, ships may increase transmission of respiratory viruses from person to person through exposure to respiratory droplets or contact with contaminated surfaces. Take these steps to reduce risk to yourself and others. Get fully vaccinated against COVID-19. Wear a mask to keep your nose and mouth covered when outside your cabin and in public settings. Wearing masks is important to slow the spread of COVID-19. Avoid close contact with anyone who is sick. Avoid touching your eyes, nose, or mouth and unwashed hands. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Proper hand hygiene is an important measure to protect yourself and prevent spread of the disease. Key times to clean hands in general include before, during, and after preparing food, before and after eating food, after using the toilet, after blowing your nose, coughing, or sneezing, before and after touching your mask, before and after caring for someone sick. Additional times to clean hands on the job include before and after work shifts, before and after work breaks, before and after handling frequently touched items such as food service carts, after handling food waste and non-disposable food service items, after touching dirty surfaces like floors, walls, and soiled carriers and equipment, after handling another person's used linens. Participate in daily temperature checks on board if required and watch your health for symptoms of COVID-19. Testing for COVID-19 is an important way to protect yourself and your fellow crew. If you feel sick, stay in your cabin and tell your ship's medical staff, your supervisor, or your captain so that the proper precautions can be taken for you and other crew members on board. Follow isolation and quarantine protocols when advised to do so by the medical staff. Learn about your vessel's protocols in case you or someone else on board becomes ill. Clean, high-touch surfaces and objects, such as door handles, sink handles, drink fountains, daily or as needed. Follow directions on the cleaning products label. Wear personal protective equipment when required to perform certain job tasks. Contact your supervisor, captain, or your ship's medical staff for more information on PPE. Use gloves when handling dining items such as cups, utensils, and serving trays used by another person. handling linens used by another person, cleaning potentially contaminated surfaces, handling garbage. Wash your hands after removing gloves. Take care of your emotional and mental health and make proper sleep a priority. Isolation and quarantine. Isolation keeps someone who is infected with a contagious disease away from others. Quarantine keeps someone who might have been exposed to a contagious disease away from others. How can I take care of my mental health? The pandemic may be stressful for crew. Fear and anxiety about this disease and what could happen can be overwhelming. Public health actions, such as keeping distance from others, can make crew feel isolated and lonely and can increase stress and anxiety, even though these actions are necessary to reduce the spread of COVID-19. You can do several things to look after your physical and mental health, which will help you to be healthier and more resilient during this difficult time. What are the signs of stress? Everyone reacts differently to stressful situations. These may be physical and emotional reactions to stress. Fear and worry about your own health and the health of your loved ones, your financial situation or job, or loss of support services you rely on. Changes in sleeping or eating patterns. Difficulty sleeping or concentrating. Worsening of chronic health problems. Worsening of mental health conditions. Increased use of tobacco, alcohol, or other substances. What should I do if I need additional mental health support? Extended quarantine and service at sea for long periods of time can be extremely difficult. Contact your ship's medical staff or captain, access your company's available resources, or call the ship's emergency number if you or someone you know needs help. Know the signs of stress. You or someone you know may experience increased stress during this pandemic. Fear and anxiety can be overwhelming. Contact your ship's medical staff or captain, access your company's available resources, or call the ship's emergency number if stress gets in the way of your daily activities for several days in a row. Who should I contact if I'm having thoughts about self-harm? Contact your ship's medical staff or captain, access your company's available resources, or call the ship's emergency number right away if you or someone you know needs help. Feelings of isolation, depression, anxiety, or other emotional or financial stresses are known to raise the risk for suicide. People may be more likely to experience these feelings during a crisis like a pandemic. However, there are ways to protect against suicidal thoughts and behaviors. For example, support from family, faith-based and secular communities, and having access to in-person or virtual counseling or therapy can help with suicidal thoughts and behavior, particularly during a crisis like a COVID-19 pandemic. Taking care of your emotional health will help you think clearly and react to the urgent needs to protect yourself, your fellow crew, and your family. Take breaks from watching, reading, or listening to news stories, including those on social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals. Exercise regularly. Get plenty of sleep. Avoid excessive alcohol and drug use. Make time to unwind. Try to do some other activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. Connect with your community. While physical distancing measures are in place, consider connecting online through social media or by phone or mail.